Democratic Republic of Congo is experiencing the highest number of confirmed Ebola cases recorded within the first month of an outbreak. The Bundibugyo strain outbreak has infected more than 1,000 people and claimed 267 lives. Our health experts say the virus had been circulating for months before authorities officially declared the outbreak on the 15th of May. Meanwhile, the United States has supplied doses of an experimental antibody treatment developed by Mapp Biopharmaceutical for use in clinical trials aimed at containing the rapidly spreading outbreak. And for an update on this, we are joined on the line by a correspondent in the DRC, Jimmy Shukrani Bakomera. Jimmy, good afternoon, and thank you for joining us on Africa Update.
Good afternoon. Thank you so much.
Jimmy, what's the latest confirmed number of Ebola infections and deaths in the Democratic Republic of Congo?
Yes, according to the latest figures released by the DRC's Minister of Health, the country has recorded 1,048 confirmed Ebola cases and 267 confirmed deaths. That's the update of 2022 June 2026. The outbreak caused by the Bundibugyo strain of Ebola virus in mainly affecting Ituri, North Kivu and South Kivu provinces. What is important is to understand that the number represents only the confirmed cases. Health officials are also investigating additional suspected cases while monitoring thousands of contacts who may have been exposed to the virus. And you have to know that this outbreak has become one of the most significant Ebola emergencies in recent years because it's affecting areas already weakened by insecurity, population displacement, and limited access to the health care.
And the WHO has blamed the surge on its quick spread to urban areas. Why is there an increased spread in urban areas?
Yes, the spread of Ebola into urban areas is particularly concerning because cities created ideal condition for rapid transmission. First, urban centers have much larger just population living in close proximity, just that is in the DRC. People use crowded market, public transport, school, churches, and workplaces every day. This has increased the number of contacts an infected person may have before symptoms are recognized and medical attention is sought. Second, we can say major cities are transportation hubs. People travel frequently between urban centers and rural communities for business, family visit, trade, and humanitarian activities. As a result, the virus can move quickly from the one location to another, making just containment much more difficult. We can say again, an important factor is popular displacement caused by insecurity. In this part of the DRC, thousands of families have been forced to move because of armed conflict, we can say, in Ituri and some parts of North Kivu province. And many are living in crowded camps or temporary settlement where access to sanitation and health care service is limited. So conditions can accelerate the transmission of infection disease.
Now,
I
Jimmy,
think
what
this is
measures have been put in place to prevent the outbreak from spreading beyond the affected areas?
yes, the Congolese government, together with the World Health Organization and other international partners, has implemented a comprehensive response strategy. One of the key measures is active surveillance. Health workers are just searching for cases investigating, alert, and rapid testing suspect patient. We're going to say also the contact tracing is another major pillar just of response. Whenever a confirmed case is identified, teams work to find everyone who may have been exposed to a person. We can say also health authorities have also strengthened the screening measures at the airports, border crossing, and major transport routes. We can say again, treatment centers have been established or to enforced to ensure that patients receive appropriate case care, just while reducing the risk of transmission within communities and health care facilities. In brief, that's are some measures taken by the government and the international partners just to struggle against the outbreak of Ebola
Now,
in the
speaking of
DRC.
international partners, we understand that the US supplied doses of an experimental antibody treatment developed by Mapp Biopharmaceutical for use in clinical trials aimed at containing this rapidly spreading outbreak. What do you know about the experimental antibody treatment supplied by the United States, and when is the clinical trial expected to start?
Yes, the treatment by the United States is known as MAP 144 34 is an experimental monoclonal antibody therapy developed by Math, of course. These antibody are just laboratory produced to proteins designed to mimic the body's natural immune response. In a simple term, they recognize the attack. So scientists have been interested with this because studies have been shown promising results against multiple Ebola virus species, unlike some earlier treatment that target only specific strain has demonstrated broader activities making in potential. The significance of the US support goes beyond the treatment itself. It reflected international effort to expand. Researchers are also hopeful that this treatment could improve survival outcome, especially when administered early in the course of the disease. However, the experts stress that it remain experimental until now, which is why the clinical trials are just necessary to evaluate its safety and effectiveness under outbreak. The arrival of this dose is therefore considered as an important milestone in the response, both for patient care and for advancing scientific knowledge about Ebola
Has the
treatment
clinical
in
trial
the
started?
DRC. Sorry,
Has the clinical trial started?
there is one of the big.
All right, we seem to have lost Jimmy there. Jimmy Shukrani Bakomera, correspondent in the DRC, joining us on the line. It is 24 after 12 Central African time.
Rise and shine.